Welcome to the Increasing Language Access in Oregon Learning Module Series. This Learning Module Series presents content from a resource called Increasing Language Access in Oregon, a workbook for providers, which is a plain language, actionable workbook focused on meeting language needs in healthcare settings. There are a total of 7 modules in the series, all of which are intended to be alternate format materials to the different chapters and appendices of the workbook. All recorded modules are available on the OHA Transformation Center website. This module focuses on Chapter 1 of the workbook, Increasing Organizational Capacity for Language Services. Chapter 1 focuses on the different ways organizations can meet patient language needs in healthcare settings, including tips for increasing capacity to provide language services. This chapter begins by explaining practical approaches to delivering interpreter and language services. It defines the main approaches to meeting language needs, such as in-language providers, bilingual staff, credentialed interpreters, and, in limited cases, family or friends for emergencies. Just like medical appointments these days can sometimes be provided in person and other times through telehealth, so can language services. The workbook compares on-site and remote interpretation methods, noting when each is most effective. The chapter discusses ways to balance patient needs with available resources, acknowledging that there's no one-size-fits-all model. Organizations are encouraged to combine approaches based on their staffing, funding, and care delivery settings to ensure compliance and high-quality communication. Let's start by looking at the 4 main types of language service providers described in the workbook. Providers, who are clinicians who share the patient's language and can communicate directly without interpretation. Bilingual staff, employees who perform other duties but can interpret when appropriate. Healthcare interpreters, qualified professionals, whether employed directly or contracted, and friends or family members, who may sometimes assist as a last resort. Understanding the differences among these options helps organizations choose the right combination to meet patient needs. Over the next few slides, we'll look at each provider type, what they do, where they're most effective, and what to keep in mind when using each approach. An in-language provider is a clinician or healthcare professional who can deliver care directly in the patient's preferred language. This model can result in smoother, more personal interactions because interpretation isn't needed. However, it is important to remember that not every bilingual clinician is automatically qualified to provide in-language care. They need to have verified language proficiency in the patient's preferred language. Additionally, in-language providers may not always be available in the required language or within the specific healthcare setting. In many settings, in-language providers are ideal for ongoing care relationships, like behavioral health or primary care, where continuity and rapport can be particularly important for building trust. Many organizations rely on bilingual staff who perform other roles, such as medical assistant, nurse, or front desk staff, and sometimes help interpret. These staff members can provide consistent support and help build trust with patients, especially when they share a common language. This approach works particularly well when bilingual staff are involved in care coordination or patient education. Only staff who are credentialed as interpreters should provide interpretation during visits. Additionally, bilingual staff may not have fluency in every language your organization encounters, and their interpreting duties can compete with their other responsibilities. Some health systems employ in-house interpreters as part of their regular team. This model provides consistent coverage and helps build stronger relationships with both patients and clinical teams. Patients often appreciate seeing the same interpreter at repeat visits. It builds familiarity and trust. In-house interpreters can also provide immediate feedback about workflow or documentation challenges. Their main limitation is frequently coverage, as organizations may not have interpreters for every language or shift, especially in smaller facilities. Contracted interpreters are professionals who work independently or through agencies. They provide flexibility, especially when you need languages that aren't common among your staff. Organizations can decide which interpreter sees patients and can provide direct quality feedback. However, because they work with multiple organizations, they bring diverse experiences, but may be harder to schedule with consistency. Language service company interpreters are professional interpreters from an outside agency who help patients and providers communicate while the patient receives care. They provide quick access to interpreters in many languages and ensure interpreters meet professional and ethical standards. While this approach improves access and speed, there is often less continuity since the interpreter may change from visit to visit. Using untrained individuals like family members or friends should be a last resort, used only in emergencies to prevent care delays. Relying on untrained interpreters can lead to incomplete or inaccurate communication. Whenever possible, providers should return to working with credentialed interpreters as soon as one becomes available. Next, let's look at how interpretation is delivered. Organizations can choose between on-site and remote interpretation. On-site interpreters are often considered the gold standard because they allow for full, nonverbal communication and trust building. Remote interpreters, by phone or video, can fill urgent or rare language gaps, especially in rural or on-demand situations. Many organizations use a combination, on-site for frequent languages, remote for less common ones. Finally, this chapter of the workbook reminds us that every organization must tailor its language services approach to its size, staffing, and the community it serves. Factors like the number of patients who need language services, which languages are most commonly spoken, and the organization's staffing and technology all affect which combination of services works best. Most organizations end up using a blend of strategies tailored to their community and resources, rather than relying on a single approach. They blend methods based on their patient mix, staffing, and care settings. As you see here, the workbook presents a high-level overview of what types of interpreters might be best suited for different volumes and variety of language needs in different healthcare settings. These are generalizations, but can be a helpful guide when beginning to think through different language service options. For example, if you have a high number of patients, but only one or two common languages, the focus can be on in-language providers and in-house or staff interpreters, or credentialed bilingual staff, helping to maintain continuity across visits. This gives patients familiar faces and steady coverage for the most frequent languages. If you have a high number of patients and many different languages, you'll usually need scale and flexibility. That's where a language service company and contracted interpreters are essential. You can also use credentialed bilingual staff. On the other end of the spectrum, if you have fewer patients and just one or two languages, the mix can lean toward credentialed bilingual staff, contracted interpreters, or a language service company. And if you have fewer patients spread across multiple languages, prioritize contracted interpreters and a language service company so you can respond quickly. The key takeaway is that language access capacity looks different everywhere, but the goal is always the same: ensuring safe, high quality, and equitable communication. That concludes Chapter 1, Increasing Organizational Capacity for Language Services. This chapter helped us look at the range of approaches organizations can use, from in-language providers to credentialed interpreters, and how to match those strategies with patient and resource needs. In Chapter 2, We'll dive deeper into who those credentialed interpreters are, the difference between qualified and certified interpreters, and why working with credentialed professionals is so essential for high quality care.